Well, welcome everyone. I'm so glad so many of you were able to join us today. As you can see on your screen, we did launch a new website to disseminate the Maryland Behavioral Risk Factor Surveillance System data. The website, we call it IBIS. That's an acronym. It stands for the Indicator-Based Information System. So very fancy name for us now. And you can see at the top of the screen, the web address is very straightforward. It's ibis.health.maryland.gov. So when you're ready to do some exploring of the data on your own, that would be the web address to go to. So from the landing page, we can see that there are a couple options on the screen. Right now, they're pretty narrowed down. We're on the welcome screen right now, which has some basic information about the website, as well as kind of a scrolling bar across the top that will display some different links that you can go to get additional information. But most of you are here because you're interested in querying the data yourself and getting access to that data whenever you need it. So what we'll do is go to Explore Data Sets right at the top and go right down to BRFSS survey data. And that's where we are right now. We can see that there's a brief overview, very brief, and then we see right now 3 selection bars below that for the 2017, 2016, and 2015 BRFSS indicators. So from here, we would go to the year of data that we're interested in. You'll notice these are the 3 years that are not available on the previous older version of the Maryland BRFSS website, which contains data through 2014 right now. And we will be working on transitioning data to this website over the coming months. So for right now, we're going to look at the most recent data, which is 2017, and I'm going to click on that bar. And you'll see when I do that, a number of different options opened up with different topic areas. Right at the top of the list is chronic disease prevalence, but we also have topic areas for some of the different modules that are collected in the annual survey. In 2017, that includes arthritis burden, cancer screening, demographics, diabetes care, module, health behavior and risk factors, so a number of different items under there, healthcare access, health status, tobacco use, and women's health. So the majority of items collected in the 2017 BRFSS survey are included here. But we're going to start right away with chronic disease prevalence. And when I click on that, we'll see that a few more options show up so we can kind of drill down to those areas we're most interested in. We see cancer, cardiovascular disease, diabetes, hypertension, and other. And other includes a number of categories such as, I'll open that up briefly so you can see it. We have arthritis, asthma, COPD, depressive disorder, kidney disease. So there are a lot of options here. But for our purposes today, I'm going to go to diabetes. And you can see we have indicators for diabetes, one that excludes women that were only told during pregnancy, and the other that includes them. The first thing you may notice here is that we have 2 options, one for accrued rate and one for an age-adjusted rate. So age-adjusted rates were not previously available from the Maryland BRFSS program, so this is something new that we have available on this website. But to keep things straightforward, I'm going to select accrued rate for now. And all I have to do is click the select button, and you'll notice there is a very large pop-up on my screen that includes a data use agreement. So this is information that everyone should read in depth on their own time to make sure that they fully understand some of the things they're agreeing to protect the confidentiality of the data and to make sure that no one is identified. There includes information about what to do if you believe that any identity disclosures or violations of the agreement do happen, and the best way to notify us of that. I'd like to direct you specifically, though, to items 7 and 8 on this list. Item 7 includes a disclaimer that you should include on any reports or publications using Maryland BRFSS data, if that should happen. And number 8 includes a citation that you can use on any reports or publications that use the Maryland BRFSS data. And the format for including that information is also included. You must agree to this to use the website and to get past the screen. So I'm going to click I agree because I do agree to those terms. And you'll see that on this screen there are a number of steps. But if you'll notice the first one, step 1, which says indicator, already includes the indicator we selected, which was doctor diagnosed diabetes. So I'm going to show you the simple way to get data. We're going to scroll down to the bottom and ignore those other steps for now and click submit. And when I do that, a number of data items will automatically populate. So what we see on this screen is that we have a map, and I'm going to scroll down quickly to show you everything we have. We have a map, and we have a data table, and at the bottom we have some data notes. So going back up to that map at the beginning, this is a map with the prevalence for our selected condition, which was diabetes prevalence, for each of Maryland counties. Now, there are two things that you probably notice right away. One is that the map does not have county labels, and the other is that the map appears to be color-coded. So I'll explain both of those right now. If you would like to see the county labels on the map, you can go to this white box in the upper right corner, and here where it says labels, you'll click on county, and they automatically appear. Next, we're going to look at the legend on the bottom of the screen, and that legend shows the color coding categories that are used on the map. So we have 5 categories that were selected using Jenks natural breaks, and these categories will be different for each outcome depending on what the data say. But for our selected condition or selected outcome, we see that the lowest category ranges from 7.9 to 9.2%. The next category is from greater than 9.2% to 10.9%, and so on. And the colors correspond to the prevalence. So when we have a higher prevalence, we have a darker color, in this case red, and the lighter colors represent the lower prevalence of the selected condition. So one thing that stands out on this map, we can see we do have one county that's in red, which is Dorchester County. So if I'd like to understand why, I can just place the mouse right over Dorchester County, and a little box pops up in the upper left-hand portion of the screen with some stats for Dorchester County. So we have the county name on top, followed by the value, which is the prevalence estimate or percent of adults in Dorchester County that have diabetes. We also see a peer group, which is a number in color, and that corresponds to the groupings that we see on the legend on the lower portion of the screen. We also see a lower limit and an upper limit. Those are the lower and upper limits of the 95% confidence interval for that value or prevalence estimate. And finally, we see a numerator and denominator. Those are the numerator and denominators that we use to calculate that value, that percentage. And these are weighted numbers. So the numerator is the estimated number of adults in that county that have the condition. So in this case, it's the estimated number of adults in Dorchester County with diabetes. And the denominator is the estimated number of adults in the county. Now, if we're interested at this point, we might want to explore some of the other counties. So we can just move the mouse from county to county and see how those rates look different when we're going from place to place. So this is great when we want to just explore the map and do a little sightseeing almost in Maryland to see how things look from area to area. But sometimes we need to use those numbers and download them and have them in a table. So if we scroll down on the screen, we'll see that we do have a table available. This table includes a row for every county in Maryland. And I would like to point out that Baltimore City is at the bottom of the list. So if you're looking for that in alphabetical order, you need to know that Baltimore City is handled differently. We also have an overall prevalence at the bottom. That is the overall statewide estimate for this condition. So in this case, this shows us that the statewide prevalence of diabetes in Maryland in 2017 was 10.5%. So let me scroll back up to the top of the table so I can show you what the different columns are. The first one is the percent with the selected condition. I'm sorry, that might be a little hard to see on my screen, but and it looks like we can also sort them as you saw me just do by accident. So you can sort these in order if you want to. So this first column is the percentage, and then the next 2 columns are the lower and upper limit of the 95% confidence interval. And then the two columns after that are what we saw on the map as the numerator and denominator. So the estimated number of Maryland adults, the selected condition, and the total estimated population size of adults in that area. There's another column called statistical stability, which is all the way to the right, and this tells us how reliable the data are and whether or not we can feel confident using them. So on this table, everything that we looked at says stable, so we can be fairly confident with those data. In some cases, you may see, for some analyses, you may see where it says data suppressed, and that would be due to statistical instability. In those cases, the data for that row on the table will not populate. And if this is something that you would like to keep and use, I would like to show you, if you scroll back to the top of the screen, there is a button that says Output to Excel. If you click that button, you'll see that automatically an Excel spreadsheet shows up. And when you open that spreadsheet, you will see all of the data that are in the table. So in this case, it says query criteria for doctor diagnosis of diabetes, excluding women who were told only during pregnancy in 2017. We see a list with all the counties, and please note that the total is on top on this output. So that would show us the statewide prevalence, which was on the bottom on the website. And then we see different columns for the estimated number of adults and the estimated total population size. So those are the numerator and denominator we were talking about earlier. The percentage with the selected condition, the lower and upper limits of the 95% confidence interval, and that measure of statistical stability. And from there, you can do whatever you need to do with the data, whether that's format a table that you need for a presentation or report, or you can use it to make graphs or whatever you need to. And finally, at the bottom of the screen, there are also a few additional buttons with some additional information about the data. The first one is data notes, and that includes some question wording. So in this case, it includes the question, have you ever been told by a doctor, nurse, or other health professional that you have diabetes? And if yes, and the respondent is female, they ask, was this only when you were pregnant? So remember, we did exclude women who were only told when they were pregnant in this analysis. And there's also a note about weighted survey data and what that means. There's an additional note about data sources. So that includes that citation we talked about earlier that showed up in the data use agreement. This includes the year, the Maryland Behavioral Risk Factor Surveillance System, how the data was accessed, and a reminder to include the date on which you accessed the data. And if you're not sure, you could check that query date timestamp at the bottom, which will give you the date. There's one more box that includes data issues. So this includes information about how the survey sample was collected, and that's the guidance that's provided by CDC. So it gives you some general information about that and directs you to the CDC's website if you need additional information. And it also provides some notes about the denominator and what it means if we group results by a second indicator. I didn't show you that yet because what I wanted to show you is how simple it is to get a lot of data using this system. If you recall, I only pressed one button to select one indicator, agreed to the data use agreement, and clicked submit, and I got all this data for all of the counties as well as for the statewide estimate. And when I'm ready to look at another indicator, all I need to do is go back and click this button up at the top that says select a different measure, and it will take me back to this screen and I can begin the process again.